Welcome to your training for helping unmarried parents establish paternity. During this video, we'll discuss the key information and techniques you'll need when performing this important work. Be sure to refer to your training manual for more detailed information and answers to questions that are frequently asked. Feel free also to contact your local Paternity Establishment Program representative. Let's get started. Did you know that children of unmarried parents are 3 times more likely to be living in poverty? This disheartening reality is just one of the many fates such children face. But when fathers participate in their children's lives, they can make a significant difference. Studies indicate that children whose fathers play an active role in their lives are 9 times less likely to drop out of high school, 10 times less likely to abuse drugs, 32 times less likely to run away, 14 times less likely to commit rape, 20 times less likely to end up in prison, and 5 times less likely to commit suicide. These statistics call attention to the vital role that fathers play in their children's lives. To grow up with a firm foundation for developing healthy lives and relationships, children need the love and support of both parents, regardless of the status of their parents' relationship. Studies show the most important indicator of whether an unmarried father will be involved in his child's life is whether or not he established legal paternity at the hospital when his baby was born. That's why helping unmarried parents take this step is such important work, and why your participation is so important. When you help unmarried parents establish the biological father as the legal father of their child, you are truly making a difference in that child's life, a difference that will last a lifetime. Let's hear from a nurse at a local hospital.
When I get ready to go into a room to discuss paternity acknowledgement with new parents, I imagine that my son is the father, and I think about what I would want him to know about how important it is to establish paternity. Then I do what I can to make sure that the father is involved in the conversation and understands both the benefits and the consequences.
The statistics we've presented underscore the nurturing, stabilizing influence that fathers have upon their children. Especially important is the emotional attachment and fulfillment that fathers experience by being actively involved in their children's lives. Emotional rewards that can be prevented if they do not establish paternity. As you talk to unmarried parents about paternity establishment, remind them of the many emotional and legal benefits it provides for both children and their parents, including giving children the opportunity to form a relationship with both parents. It's important for a child to know their father and mother, and they benefit from a relationship with both. Once paternity is established, the father is more likely to maintain his relationship with the child. His extended family may also be more likely to participate in his child's life. Another benefit is helping children develop a sense of identity. Children have a need to know both parents and their family history to develop a sense of identity and family belonging. Only if unmarried parents acknowledge paternity will the father's information appear on the child's birth certificate. In the absence of a signed paternity acknowledgement or a formal paternity proceeding, the father's section on the birth certificate remains blank. Establishing paternity also provides children with access to both parents' medical histories. When parents acknowledge paternity, the child will have access to information about medical histories on both sides of their family. This is especially important in situations in which the child inherits a medical problem. Additionally, after a father completes a paternity acknowledgement form, he may be able to add the child to his medical insurance policy. Establishing paternity also ensures that both parents have custody and visitation rights. If parents are unmarried at the time of their child's birth, the mother is presumed to have custody. However, by completing the paternity acknowledgement form, the father can ask the court for visitation rights and share in custody arrangements. Establishing paternity also affects adoption rights. Once a father acknowledges paternity, he gains the right to be notified of any plans to have the child adopted by someone else. This provides an important safeguard for the father, the child, and prospective adoptive parents. Paternity establishment provides access to financial benefits. Acknowledging paternity potentially allows the child to qualify for important financial benefits from the father. Possibilities include Social Security, life insurance, pensions, veterans benefits, and inheritance rights in the event that something happens to the father. Establishing paternity is necessary for access to child support. By establishing paternity, both parents are motivated to contribute to their child's financial and emotional security because both parents are legally and financially responsible for their child. This reduces the likelihood that either parent will have to apply for public financial or medical assistance. If the parents choose to separate and paternity has already been established, it will be easier for the custodial parent to obtain child support to aid in providing for the child. The income from child support can help keep a child from living in poverty. Finally, establishing paternity means that a child will have the same legal rights as a child born to married parents. The role of hospitals in helping unmarried parents establish paternity is an important one, and one that is mandated by law. Both federal and state laws require hospitals to provide unmarried parents with the information and forms necessary to acknowledge paternity voluntarily, as well as to have trained staff on hand to answer their questions. To that end, hospitals are in an especially strategic position for doing this work. The birth of a child is typically a joyous occasion for the entire family, especially the new parents. It is also the ideal time to engage the father in a discussion about ensuring his legal rights to his child, as well as providing his child with all the benefits that legal fatherhood brings. Let's now review the process for establishing paternity at the hospital. We'll then take a look at some best practices. Helping unmarried parents establish paternity at the hospital is basically composed of two parts. Number one, ensuring the parents are made aware of the affidavit along with the benefits and consequences of signing it. And two, making staff available to complete the document. While the process itself is simple, the context in which it takes place poses significant challenges. Hospital stays, though joyous, are also emotional, hectic, and typically brief. Thus, finding time to introduce and explain the affidavit can be tricky. Keeping this in mind, the first step in helping parents establish paternity at the hospital is to call the mother or stop by her room as soon as possible after the birth of the child. Make an appointment with her to collect information for the birth certificate and discuss paternity at a time that is convenient for her. Make sure to tell the mother you need to meet with both parents if possible, and request that the father be there for the appointment too. Also, remember to leave your phone number with her in case they need to reschedule the appointment. Stress that it's important that the father be present at the appointment and to please reschedule if necessary to ensure he can attend. Finally, make sure the parents know they both need to have a valid government-issued photo ID as well as their Social Security number if they are U.S. citizens to complete the birth certificate and paternity form. When you arrive for the appointment, ask everyone besides the mother and father to leave the room before you begin gathering information for the birth certificate and explaining paternity. This will help you collect the information more quickly, and it will provide privacy for your patients. You may want to consider speaking with the parents separately if you think the father feels pressured. Finally, be sure to approach the father with concern and compassion. Be friendly, open, and ready to answer any questions he may have. If you have not already done so, give him a paternity brochure and a list of frequently asked questions to read over. It may also help to show both parents a video on the importance of establishing paternity, which features young men and women the parents can relate to. Let the father know paternity establishment benefits both his child and himself. Next, let's look at several best practices that hospitals across the nation have found effective. First, make it a point to provide all unmarried parents with whom you come in contact with a brochure explaining paternity and answering frequently asked questions. It's also important to ensure that at least one staff member owns the paternity program. Staff ownership and enthusiasm are keys to program success. Let's hear from a nurse about her team's steps to help educate unmarried parents about the importance of establishing paternity.
At our hospital, we take every opportunity to inform unmarried parents about paternity establishment. We give every patient a brochure explaining what it is, why it's important, and how it's done. We also display these brochures in waiting rooms and hand them out in the childbirth classes we teach. We show a video on paternity establishment, answer questions, and even give parents the opportunity to complete a paternity acknowledgement before they leave. If anyone has any doubts, we give them information about DNA testing. We do everything we can to help unmarried parents make the right choice for their child.
You may also want to consider locating a medical records health information management office on the same floor as the birthing rooms. The simple act of making it easier for hospital workers to access new parents has been shown to dramatically increase in-hospital paternity establishments. Lastly, make sure you have enough notaries and staff who can complete paternity acknowledgments available at key times, including nights and weekends. Strong programs build checks into their systems to remind nursing, medical records, and social work staff to offer the affidavit. Next, let's hear from another nurse about his experience working with unmarried parents.
It's just not possible for a lot of dads to come to the hospital during business hours. That's why we work with our nurses to make sure that someone can help them establish paternity in the evenings or on the weekends when they can come to the hospital.
The South Carolina Parenting Opportunity Program, or SCPOP, helps hospitals improve their paternity acknowledgement programs by providing training for hospital staff on how to talk with parents about paternity acknowledgement, conducting site assessment visits at each hospital in the state at least once a year, holding regional training conferences at 4 South Carolina locations every year, sharing best practices and distributing a quarterly newsletter to keep your staff updated, identifying challenges and barriers and providing solutions to overcome them, providing materials to properly educate parents about paternity establishment, including brochures, flyers, and DVDs, offering monthly statistical monitoring to track performance, providing information on DNA testing options for parents who are not sure who the father is, and actively increasing awareness and education about paternity acknowledgement prior to birth at OB/GYN offices, county Medicaid and WIC offices, fatherhood programs, crisis pregnancy centers, and maternity stores. Establishing paternity is so much more than a simple administrative process. It's an important milestone in the life of the child and creates the opportunity to have a meaningful conversation with the parents about the roles they both will play in their child's life. Establishing paternity creates a foundation for developing healthy lives and relationships and enriching the parents and the child with a sense of family and belonging. It also reduces many of the risks children face from having absent fathers. Helping families establish paternity is a noble endeavor that gives children the opportunity to thrive, prosper, and excel. And that, in the end, is what every child deserves. Thank you for your help in doing this important work.